We are here today with Julie Mills Watson, owner of Body of Health. And Julie, you're going to talk to us today about lymph, but you're going to show us something special. What were you going to show us today?
Yes, many of my sessions I use this lymph machine. I normally don't like using machines, I like using my hands. And this is a tool. It is not the end-all be-all for lymph therapy. We open the pathways of lymph manually with our hands, making sure everything is flowing in the right direction. But sometimes we have an entire leg or an entire torso that we need to get the lymph moving on, but we only have an hour to do it in. So this machine is made specifically for lymph, and it helps move the lymph a lot faster.
And can you give us just a quick reminder on what lymph looks like and why this would work the way it does?
Oh, absolutely. So we have our own lymph system. It has its capillaries and nodes. Those capillaries do not have an opening at each end. They have openings all along the capillary, and they're sort of like fish gills. And these gills are connected to the derma of the skin. So it takes very little to move and open the lymph capillaries to let that interstitial fluid in. So they're the little suction cups is what these are. And they have a little vibration to them as well. And it just lifts the skin just enough. It's non-invasive at all. It's not like cupping, nothing like that. It's very, very gentle. And as we slide the cups, it opens those vessels and lets the lymph in. So I'll give a little demonstration for you. It has a little rhythm to it. And I don't know if you can see this, but it's sucking. And as it sucks and we move, you can picture those capillaries opening. And it draws the lymph out of a limb and stimulates all the area around it. And we just do multiple swipes so that it can move the lymph.
And now, do you have different sizes of this, or is that just one size fits all?
Absolutely. There's the larger ones, and then we also have a really small facial one as well. So there's 3 different sizes because it's never one size fits all. You've got to get around an ankle, you might want to get around a wrist. But remember, we're dealing with edema, so most of the time you're going to need a larger size cup because we've got an entire leg or an entire torso, an entire back, that kind of thing that we're working with the Lymphmed machine. It's like, again, it is a tool. It is not the only way to move lymph. Most of the time we'll be using our hands to move the lymph, but I love this machine because it lets me get a lot more done in an hour. It gets a lot better therapy that you get. It's more precise, and it is a great assistant tool to move your lymph.
Well, thanks for sharing that information. That's something new and different.
Thank you.